All right, hi everybody. Um, so we're going to do this a bit differently where it's just going to be the video lesson that I give you on your day away from school due to me being away from school on Thursday. So we're going to cover respiratory disorders, not too terribly long of a lesson today. 1, 2, 3, 4, 5, 6, 7, 8 slides that we'll move fairly quickly through. No drawings of mine to include here, so we'll get started right away. The first thing that we have to identify is that there are going to be 4 different categories of disorders here. And the first ones are upper respiratory tract infections. So these deal with structures of the upper respiratory tract. So that includes in your nose, your nasal cavities, your pharynx, and your larynx. So all of these are connected, as a lot of things are in the human body. Infections can spread to your sinuses as well as to your middle ear. And viral infections can lead to secondary bacterial infections. So they can get much, much worse. So as you're finishing copying down upper respiratory tract infections, the first one that we'll discuss is strep throat, which could be very familiar for most of you. It's caused by a bacteria, so that's a bacterial infection caused by a bacteria called Streptococcus pyogenes. If you've ever had strep throat, you would have had common symptoms like a sore throat, a high fever, as well as white patches at the back of your throat. The next upper respiratory tract infection that we'll discuss covers an infection or a disorder to the sinuses. Now, we've talked about sinuses and how they are basically cavities or caverns or holes in your bone. We've identified where those are on your face. But sinusitis is basically anytime you've had congestion of your sinuses. So nasal congestion that blocks your sinus openings, postnasal discharge or facial pain, just pain in your sinus areas. And sometimes for treatment, spray decongestants can help with drainage of your sinuses. Some of you may have even tried what's called a neti pot, which where you get some distilled water and you mix in a saline powder in, and then you insert it into one of your nostrils and tilt your head, and it goes up into your sinuses and flushes it out. It's called like a nasal rinse. Okay, so as we move on here, our next one that still deals with upper respiratory tract infections, because we're going to have 5 under this category, is otitis media, which is a great name. Otitis media is a middle ear infection that spreads from your nasal cavity through your eustachian tubes, which are part of your ears. So it goes from your nose area and then travels upwards to your ears. The main symptom here is pain in your ears, sort of an earache, and typically things like antibiotics will help if it's bacterial. If it's viral, unfortunately, can't give any antibiotics there, and we'll talk about that in the immune system next. As well as trypanostomoid tubes. I don't know how to pronounce that properly. If it's a chronic or recurrent infection. Okay, our fourth one here is tonsillitis, and some of you may have experienced this as well. So this is the inflammation of your tonsils, and typically what's done is called a tonsillectomy, where your tonsils are taken out. Sort of a one-day procedure. There are a lot fewer done today, now that in terms of immune system, the importance of tonsils has now been recognized. Okay. The next one is laryngitis. So laryngitis is an infection of the larynx. Now, laryngitis deals with some hoarseness of your voice, so it'll be a little raspy or it'll be a little sore. I like to always make a good old dad joke that it's laryngitis. Laryngitis is like a pony because your voice is a little hoarse. Sorry, that was really bad. Um, and so there's persistent hoarseness without even having an infection. That could even mean worse things and could indicate cancer. So those are the five there. There's strep throat, sinusitis, otitis media, tonsillitis, and laryngitis. As we move on here now, we get to lower respiratory tract infections. And the first one that we're going to cover is acute bronchitis. So as indicated by its name, bronchitis deals with the bronchi, specifically the primary and secondary bronchi, so on the both left and right sides. And usually it's a secondary infection, so not the first and primary thing that shows up. Its prime symptom is a deep cough with expectoration of mucus or pus that you're coughing up. So that's bringing up of mucus or pus when you cough. Next is pneumonia. Pneumonia is an infection of the lungs, and it can be viral, it can be bacterial, depending on the pathogen that first infects it. And pneumonia is where you have fluid in your lungs, specifically deep in your lungs in the alveoli, as well as the bronchioles. So really deep in your lungs, and it's really tough to cough out sort of any pus or mucus there. Following with pneumonia and the fluid-filled lungs, there's a high fever, chills, as well as possible chest pain. It can be generalized to both lungs or isolated to even specific lobes of a lung. Now, pneumonia more specifically can be dangerous if it's a pneumocystis carinii pneumonia, which is very often found in AIDS patients. And we've talked about AIDS very briefly earlier, where you have an immunodeficiency sort of syndrome. So this can be really disastrous with getting pneumonia if you have AIDS, because your body won't be able to fight that off. Okay, next is tuberculosis. Specifically, pulmonary tuberculosis is the longer name. And there's a bacterial cause of this called tubercle bacillus. That's the name of the bacteria, the scientific name, the Latin name, where infected tissue encapsulates a bacteria and it's forming what's called a tubercle. So tissue of your body surrounds the bacteria, and then that actually becomes even worse in your body. So your state of your immune system will determine whether it's going to be an easy journey or a tougher journey into the road to recovery. If you have a competent immune system, usually the infection is walled off and stops there. But if you have a compromised immune system, the infection will spread more into your lungs, and then these tubercles will be more prominent. Treatment's done with antibiotics. Because it is a bacterial infection, and antibiotics can treat bacterial infections. Anyone who does have tuberculosis is typically quarantined because it is a bacterial infection. It can be contagious as well. Relating to COVID-19, there were early reports last year that being very reductive and very simplistic, that it's a type of pneumonia. I meant to mention this on the pneumonia slide there. So it's like a viral pneumonia that becomes very dangerous in terms of breathing and affects your breathing. And of course, people who are older get affected worse. Our third category are restrictive pulmonary disorders. So we talked about in our last lesson vital capacity and your entire breathing from the maximum amount you can breathe in to the maximum amount you can breathe out. So in restrictive pulmonary disorders, your vital capacity is reduced and your lungs no longer are no longer stretchy enough to really increase in terms of volume of air that can be taken in. One of the very common restrictive pulmonary disorders is pulmonary fibrosis. In pulmonary fibrosis, it's usually caused by an inhalation of particles that are foreign to the body, things like silica, asbestos, or coal dust, and then they get stuck in the lungs, and the lungs can no longer inflate normally. Put those up there for you. So that's the only one that we're going to talk about here in terms of restrictive pulmonary disorders. Remember that the word pulmonary relates to the lungs. And lastly, we have our obstructive pulmonary disorders. And with our obstructive pulmonary disorders, we are now, instead of being restricted, it's starting to form a blockage. So there's a decreased airflow going into your lungs. And of course, that can be fairly dangerous, because if you have a decreased airflow, you have decreased oxygen getting to your lungs, and then a lower oxygen transferring into your bloodstream. The first one we'll cover here is a chronic bronchitis, where your airways are always inflamed. So we talked briefly about the mucociliary apparatus and how it does its job to clear any dust or debris that may go into your airways. And instead of just coughing that out, your airways for chronic bronchitis will always be painful and inflamed. So you still have a productive cough, but there are changes in your bronchi where they have degenerated. They've lost the mucociliary apparatus, and it's very common for people who are smokers or are in the area of pollutants. So you can be predisposed to the condition of chronic bronchitis when you're a smoker or working around with pollutants often. The next one is emphysema. So this is where your alveoli, the things that have capillaries that exchange oxygen for carbon dioxide in your lungs, are now distended or stretched. And because of this, they have a loss of surface area for gas exchange. In a case of emphysema, air is trapped in your lungs due to alveoli damage, which means your heart has to work even harder to have oxygen pumping through your systems. Typically, for somebody with emphysema, supplemental oxygen, like an oxygen tank and a breathing mask, drug therapy, or even exercise may help. And lastly, probably one of the most common obstructive pulmonary disorders is asthma. Some of you may have asthma or maybe suffering from asthma, especially now because it's springtime and allergens are in the air. So this is where you have a sensitivity in your lower airways, and smooth muscle is getting constricted in your bronchioles. So they're really tightened up. They're constricting the bronchial diameter. So they're actually smaller. What this does is create a wheezing that is sometimes termed musical, because it's audio, or you can hear it. Audible, that's the word I'm looking for. It's audible. Things like a puffer is called a chemical mediator that you inhale, and it will help the bronchioles open up. So they're called bronchodilators. The second last point here, where chemical mediators in the bronchioles cause a bronchospasm, is as a result of the airways closing. So they start to spasm, and that can create sort of a worrisome reaction and inability to breathe. So yeah, inhalant medications like puffers are things that are there to aid with asthma. And the very last one, the obstructive pulmonary disorder that we're going to talk about is lung cancer. So this happens in progressive steps, as cancer often does, and it relates to a thickening and callousing of mucosa in your bronchi. So what mucosa are supposed to be are nice and smooth and slippery, and those start callousing and thickening and hardening up in your bronchi. Your mucociliary apparatus, having cilia, which are receptors, little finger-like projections, those start to get lost, and then cancerous changes occur in your callus cells and start attacking that area and becoming a tumor. On the last slide here is a picture of a normal lung versus a cancerous lung. So obviously the one on the left is a normal lung that's fresh and it probably has been dyed, unless it's extremely fresh, but it's red and vibrant with oxygenated blood. Whereas the one on the right, you will see there are these sort of white patches that are circular, and those would be those tumors that are growths, uncontrolled growths of the cells in the lungs. Of course, it's a cancerous lung. Probably you can tell by the blackening of the tissue is due to smoking. So that's all for this lesson. It was a bit longer than I thought it would be, but that relates to the end of the chapter, I believe chapter 15.4 in your textbook. So if you'd like to supplement the information given in these notes, you can read that chapter in the textbook. All right, that's all for today. Take care, everyone.